Dr. John Spencer, and welcome to STEM Forward, where we explore careers that push society forward through science, technology, engineering, and math. Today, we'll be diving into the crucial role of substance abuse, behavior disorder, and mental health counselors, and how important they are to our community.
Hi, I'm Dr. Stephen Jones, and today we're going to talk about how these counselors play a critical role in supporting individuals through addiction, mental health struggles, and other challenges. There are a lot of things that are happening in the lives of people throughout the country. We want to make sure that we're meeting their needs from a mental perspective. We want to explore what they do, how to become one, and why it's in high demand.
You know, Steve, as we're recording this episode, we're right in the middle of the holiday season. And one of the things that I often tell my teachers when we get around Thanksgiving is that, we have to keep things tight. We have to keep our ears and eyes open because, yes, the holidays are a great time for many, but for a lot of people, suffer from depression. A lot of people suffer from sadness because of loss or various traumas. And so, what we'll try to do today is to dive into what these counselors actually do. We'll discuss their work environment. We'll talk about what it takes to become one of those professionals. And then finally, we'll talk about job outlook and, what they can expect in terms of salary and career growth over the next decade. So let's get started, Steve. What do substance abuse, behavior disorder, mental health counselors do? So let's start with the basics about what they do.
Well, the counselors help individuals to tackle a wide variety of challenges related to addiction, mental health issues, and behavioral problems. I know, again, in working in a education setting, and even in higher education, we often deal with some of these same issues at the college level. So you're addressing it at the K-12 level, but there's still a lot of issues that we face that require counseling. And so we have a whole staff that supports that. So for example, people might be going through different struggles with alcoholism, depression, anxiety, or other types of addictions, even on a college campus.
So that makes me think of a conversation I've been having with young people in recent weeks, talking about recreation and addiction and self-medication. Because as you just outlined, alcoholism, depression, anxiety, that, I'm encountering many teenagers that are experimenting with different types of drugs to deal with their own depression or anxiety. And I'm trying to encourage them to seek professional help instead of trying to self-medicate themselves with illegal drugs. So having these professional counselors, they play a vital role because they provide practical tools to recovery. Part of what they do includes assessing a client's mental health and physical health, developing treatment plans and assisting behavior challenges to aid recovery, and to help families understand that addiction and behavior disorder and provide support in those relationships. Because I see a lot of parents, struggling, especially with teenagers, middle school students saying, I don't know what's going on with my child, Dr. Spencer, that they're sad, they want to stay up in their room. And one of the things I say, you got to keep talking to them. And when it's beyond what you can do as a parent, you need to get professional help for you and your child, because your goal, I believe, is to help your child transition and become a successful, happy adult that can take care of themselves.
And I think a lot of parents suffer from isolation, or in certain cultures, they don't want to let the community know that their child has an issue. And so they keep it to themselves. And that kind of makes it even more challenging that they're not sharing. So the awareness of the addiction or behavior is one level. The next level is taking action steps to get there. So I think you're right, John. We need to be open in our communication and connecting with people around these issues on an individual basis, and also facilitate possibly these individuals who are helping us will provide group therapy and counseling sessions. In some cases, they might even work with individuals ordered by the judge, referred to other institutions like parole officers, to help them overcome their addiction or behavioral issues.
Mhm. So one of the things, some of the roughest days in K to 12 education is when you have to call the crisis team because a child is having a breakdown, a mental
Mhm.
breakdown that's beyond what the school can handle. And
Mhm.
so these are the types of counselors that come and intervene um, when needed, which can be stressful, but it's a big part of their job. They make sure before you get to this point, why they're so important, they try to give people that are suffering from mental health issues or other behavioral disorders and things of that nature, addiction, they try to give them tools so they can manage this stress and life challenges so they don't have these types of crises that impede them from having successful days, successful weeks, successful months, and so on, and
Mhm.
productive, healthy lives.
Yeah, I think you're right, because this kind of role requires a lot of patience, understanding, commitment, communication. Um, Clients are in extremely difficult situations, and it requires more than just one person working together to help them um, address these profound life issues. And that's why these counselors are such a vital part of the healthcare system. I think with COVID, a lot of health issues were exacerbated because we were home a lot more. They weren't interacting with people. And we definitely saw it at the university level that we had a lot greater need for counseling of our students because of the isolation that happened during COVID. So we need more of these professionals to address the issues. In fact, we had to contract with people outside the university to help address the issue. So it's definitely there, it's growing, and it's needed.
Hmm. Hmm. Well, Steph, one of the things I was trying to look up, because I know anecdotally over the last couple of years, the suicide rate has definitely gone up. But as we go through, I'll see if I can pull up some charts so we can illustrate to our listeners. If not, I'll provide them um, in the show notes because that is a
Mhm.
troubling concern in K to 12, and I also believe in higher ed. Whether it's the increased suicide rates or the increased use of drugs or self medication that leads to overdose or some sort of other medical type emergency. So if you're out there listening and you're interested in helping people overcome some of life's
Mhm.
toughest struggles and challenges, this would be a great field for you to explore. But remember, um, you got to have a certain level of compassion, a
Mhm.
certain level of empathy. And we'll be talking about that, a little bit more as we dive deeper into this during this episode.
And don't forget to subscribe and share the podcast with your friends. We'll be right back after a short break. Do you want your students to earn excellent grades? This is Dr. Stephen Jones, author of 7 Secrets of How to Study, the nationally recognized book, and my online course. The students in your organization can earn A+ grades in just a few hours. Get the 7 Secrets of How to Study course for your students. You won't regret it.
We are back. Let me share this screen because I did find some data in terms of what we were just talking about, in terms of suicide. So let me share my screen. So from 2009 to 2019, the age-adjusted suicide rate did increase to 11.8 per 100,000 to 13.9. The rate's a little lower in 2019 than 2018. That I think is for overall for males. But look at the age ranges. It goes 10 to 14, 15 to 24, 25 to 44, 67 to 74, 45 to 64, 75 to 84, but then 85 or older. I'm wondering how people think about, in terms of that age group, in terms of the suicide rate. And as our population ages, and that's what makes the need for the type of counselors that we're talking about, because so important. But I'll make sure that this is in the show notes so people can check it out. But now we know about what these types of counselors do. Let's talk about where they work and how you can get into the field.
With substance abuse, behavioral disorder, and mental health counselors work in a variety of environments. Most commonly, they are found in outpatient mental health centers. There's substance abuse places as well, treatment centers, residential facilities, even correctional institutions.
Yeah. That's a very wide variety. So since they can work in like places, hospitals, or juvenile detention centers, or private practices, those work settings can depend on the type of clientele and the treatment provided. Because if I think about juvenile detention centers, depending on the age range, in the various types of hospitals, whether it's a mental institution or a regular type of hospital.
And while counselors work full-time, part-time work is also common. Some settings may require evening or weekend hours, especially in dealing with residential treatment facilities where clients need around-the-clock support. So there are places where they actually stay in a living environment and they constantly are in contact with counselors. And I have a nephew that's going through treatment right now over several months. So it may be actually over several months that they're working with them to help them get through the condition that they're in.
And it could be various age groups. I've had students as young as kindergarten in various types of facilities, or middle school students, teenagers, high school students. Sometimes we have a behavior health worker come into the school to observe or just to have a talk or walk around with the student during their day for behavior modification of things of that nature. But let's talk about what does it take to get into the field. And we know it's not a one size fits all kind of path.
Exactly, you're right. Education requirements can vary depending on the counselor, the area that they're counseling in. For substance abuse and behavioral disorder counselors, you typically need at least a bachelor's degree. However, for mental health counselors, master's degree is usually required. I always say, like we've been talking about education, the more education, the greater the possibilities. Also, it is important to your income that you have these additional degrees. So it's definitely something to consider as you're going into the field.
Hmm. Hmm. Many of the programs may have internships. Definitely going to have a supervised clinical experience, and not just going to turn you loose working with clients without that type of experience. They're going to make sure that you gain real world experience, having maybe field practicums or things of that nature. In fact, there's some type of licensure. Like I have friends that are licensed professional counselors and things of that
Hmm.
nature. And you can even go into private practice, but a license is a must. And with one of
Yeah.
those things, the license gives you opportunity to go where you want to go, live where you want
Hmm.
to live. It gives you flexibility. So having that professional credential is very important.
Yeah, and just like applying for jobs, some of the jobs, even in this profession, may require a bachelor's, some may require a master's. That's going to be in the job description that you
Hmm.
actually have to have these education requirements and the licenses to go along with it. In a lot of these professions, my wife's a nurse and she has to renew her license every so many years. So it may be the case that depending on the kind of counseling that you're involved in, you might need to renew a license. And just varies state by state. And once you pass the exam, you'll get a certificate, and that's something that you can use as you're applying for jobs. And it just confirms that you have the right education and you have the right skill and ability to do this kind of job.
Yeah, it definitely requires dedication and ongoing
Mhm.
learning. You don't want to get stale in your profession. You want to make sure that you're up to date on the latest skills and techniques, so you're providing clients with optimal care, so they can
Mhm.
move on and progress in their lives. But the good news is there's a lot of support from professional organizations. Counselors can gain certifications to enhance their skills and career prospects, like you just said.
Mhm. And for anyone that's interested in the field, it's critical to have good communication skills, compassion. I think is so important because you're talking to people who are in some dire situations, depending, and they need to know that you're also going to be a good listener, um, and that you have the traits for empathy, that you can relate to the thing that they're going through, and that you can talk to them in such a way that they'll feel as though they're getting a resolution to their problem. So it's difficult, it's challenging. Every day is a new day with these experiences that you have, but it's worth being in the field.
That's great. That sounds great, Steve. All right, it's time for a quick reminder. If you find this information helpful, make sure you subscribe and share this episode with anyone that might be interested in becoming a counselor. We'll be right back to talk about the job outlook and salary. Are you a solo entrepreneur, entrepreneur, or small business owner looking to establish a strong online presence? At Teach It Labs, we specialize in creating mobile-friendly websites tailored just for you. Our customizable templates are easy to showcase your brand without any coding experience. Plus, with our learning management systems hosting, delivering educational content online has never been simpler. Ready to elevate your business? Visit teachitlabs.com and let's build your digital future together. Welcome back. Now, let's talk about the future of this career. Substance abuse, behavior disorder, mental health counselors are an in demand field, which is great, but you got to think about why they are in demand. Some would say that we have an addiction crisis in this country.
Hmm.
With the use of illicit drugs, and we have the opioid crisis, we have the fentanyl crisis, and things of that nature. Um, so it's like a double-edged sword. We have people that are struggling, dealing with addiction and things like that. But It has created an in-demand job field with a projected growth of 19% over the next decade.
Mm-hmm.
But one thing I will say, if we can reduce the number of people that are addicted and things of that nature, this is the type of field that you can transition into other types of counseling, especially with the aging population that we have.
Mm-hmm. And also, there's marital counseling that is needed as well. A lot of couples get that. So this is a faster than average occupation in terms of its growth opportunity. And the reason for the growth increasing demand is the mental health of our nation and the challenges that people are facing are blossoming into different directions that haven't happened in the past. So we need more people to also deal with the current issues related to the area of mental health and addiction. So mental health issues, the rise of mental health awareness, counselors are needed more than ever. And we're hoping that you might consider this. If you're a person that helps a lot, that really cares about people and are concerned about people, this would be a great profession to get into.
As you mentioned earlier, Steve, these types of counselors work in all types of settings, and some of the biggest employers are outpatient mental health centers, individual and family services, and residential facilities. So there's a clear demand across multiple sectors.
Mm-hmm. Now, that's a great point, John. And if you're wondering about compensation, the median annual pay for counselors in the field was about $53,710,000 in 2023. That works out to around $25.82 per hour. Of course, that can vary based on experience, location, and the industry you're working in.
And that is a livable wage. One of the things we talked about earlier with licensure, and maybe doing some things in private practice that can definitely impact your earning potential. I know many counselors that do work for outpatient organizations, but then also run private practice and have clients on their own, but they have the credential that allows them to do that. Without the credential, you can't deal with that entrepreneurial aspect and generate income outside of your employer. So some of these counselors, especially working in hospitals, private practices, can earn higher salaries. So like a counselor working in a hospital has a median annual wage of $59,000, while those working in outpatient centers make about $51,000.
Mm-hmm. It's a career that offers a lot of potential, both in terms of job growth and earnings. Plus, it's incredibly rewarding work. Being able to make a positive impact on people's lives is priceless. And all of the things that you're putting out to help them also benefit you in terms of feeling fulfilled that you're helping them and helping their families as well to get through this crisis period.
Absolutely, Steve. So if this career sounds interesting, like I said, if you got a big heart, you're empathetic, but you're still not sure if it's right for you, there's similar occupations that you can look into. Like Steve mentioned earlier, marriage and family therapists, health education specialists, and even probation officers. These are some of the roles helping people through difficult times with slightly different focus. But it's a wide open area that you could pursue different types of professional credentials to help your community.
That's true, John. And definitely there's no shortage of ways to serve the community and to make a real difference in the lives of young people and their parents.
Well, that is all the time we have for today. We hope this episode has given you valuable insight to the world of substance abuse, behavior disorder, and mental health counselors. And if you know somebody that's interested, we've said this in our other podcast episodes, make sure you turn them on to STEM Forward. Our goal is to provide information about various pathways in science, technology, engineering, and math to make sure you are better informed about career options that are out there for you.
And don't forget to subscribe and share this podcast and leave us a review that you've enjoyed today's episode. Thanks for tuning in to STEM Forward, and we'll see you next time.
Thank you for tuning in to STEM Forward. For more information about this episode, visit our website and check out the show notes.